Hello, I'm Todd Robbins, owner of Robbins Rehabilitation, and I wanted to check in with you. Now you are kind of later on down the line through your course of care, and hopefully at this point we're seeing more improvements, more changes, and I just wanted to check in with you and see how you were doing. At this point, after we've had some physical therapy and you're following up with your exercises at home, we're probably seeing some improvements. Hopefully you're having less pain, you're getting more motion, you're doing more things at home that you weren't able to do in the past. And commonly, our patients will get improvement, but sometimes we get kind of stuck. Or very classically what happens is we get a good amount of improvement in the beginning and then we have what's called a plateau. Okay? And this is pretty common, particularly for chronic type injuries that have been bothering people for a while. And I get a lot of patients that do well and then kind of hit this plateau and they feel like, well, I'm not seeing the improvement that I did initially. This is very natural. What I encourage you to do, stay with it, okay? The patients that are on the plateau but continue with physical therapy and really focus on their home program, eventually they go up again, okay? But there can be a space in here where you're feeling a little frustrated, and I get it. Trust me, I understand it. But your therapist is reevaluating you along the way. You may be making more improvements than you think. Sometimes it's hard to tell if I'm getting more motion or if I'm getting stronger. That's why we check in with you, do our reevaluations. Then we know this is where you were on day one, and now this is where you are later on down the line, and we're making progress. I really want you to hang in there with physical therapy. And what I always tell people, it's not a magic wand. I really wish that it was. Physical therapy involves typically some time and effort, put into getting better. Remember, it's probably taken you a while to get to the point that you're at. If you've had an injury that's been nagging and hanging around, lingering for a long time, it's going to take some time to get past it. So you gotta hang in there. It's really important. And remember, our goal is to get you to successful discharge. We've talked about this before, but I want you to be 100%. The closer we can get to 100%, the better chance you have of maintaining that and staying healthy beyond that point. If you feel like you're kind of lost or you're not sure where you are on kind of like our roadmap, so we've got a map for your recovery. If you're not sure where you're at, there is confusion, reach out to your physical therapist, okay? You really got to talk to them and communicate. That's such a big part of what we do. If you're confused about what you should be doing at home or why you're doing certain things in treatment, trust me, there's a plan for it. But we want you to know what that is and be on the same page with us. So really reach out, talk to your physical therapist. And I do have patients at this point where, well, I've gotten better, but I'm not 100%. I've kind of plateaued here, and this is the point in therapy where sometimes patients just kind of disappear. I say, well, maybe this is as good as I'm going to get, or well, maybe I'm not going to get any better than this, and like why am I still going to physical therapy? Again, trust me, I've been doing this for 20 years. Very often we'll get on this plateau and you get a little bit disappointed. We've got to push to that next spot to get you up to get towards 100% recovery. So don't disappear. Talk to your physical therapist, and there's other things that we can do for you. Maybe physical therapy isn't exactly what you need. Maybe we need to be referred out somewhere else. We need to make some changes. Communicate with us about that. Maybe you need to see a different physical therapist. All of our physical therapists are great, but we all have our own unique skills and ways to attack problems. So very often, if I'm struggling with a patient, which happens, I'll talk to another therapist, say, can you take a look at them? I'm just not getting where I need to be with them, and I want to see what you think about it. So working with another physical therapist at a different angle can kind of help you out too. But don't give up, okay? I want you to hang in there. I want you to get to 100%, get to graduation day, and get your successful discharge. That's where we want to be. If there's anything that I can do to help you get there, anything that's not going well, reach out to me personally. I really want to help you out and get you where you need to be. You can email me, todd@robbinspt.com, or call our offices and ask for me, and I will get back to you and make sure that we're on the right path to getting you better. So, hang in there. You're gonna get to the end, and I really look forward to seeing you get to a successful discharge.